afternoon, everybody. Today is May 28th, 2021. My name's Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update. Our email is health@falmouthma.gov. The website for the most recent information is falmouthma.gov. The health department's phone number is 508-495-7485. So, starting tomorrow, I guess this would be Maskless Eve, all COVID-19 sector-specific guidance, gathering orders, and most mask mandates do expire on May 29th, so tomorrow. Masks are still required at K through 12 schools during mass transportation, congregate and healthcare settings. We had local mask mandates that went into effect prior to the governor's orders back, I want to say April 27th of 2020. The Falmouth Board of Health and the Select Board voted to get rid of those mandates, but did issue an advisory to continue with masks on indoor spaces. So it's not a requirement. Some businesses, if you're a private business, have the opportunity to require them. We're advising that you probably may still want to wear them. You really should if you're still not vaccinated. The guidance pretty much goes in terms of gatherings and so forth tomorrow. The governor is looking to extend, if the vote hasn't happened yet, to extend outdoor dining till November 29th. So as far as guidance, it's pretty much all gone starting tomorrow. In terms of vaccine availability, there's plenty of vaccine. The state's pre-registration system is closed as of this week. You can still find vaccine at vaxfinder.mass.gov. It's going to show you mostly pharmacies. Pharmacies have plenty of vaccine. I've seen, I've checked it occasionally and find that there's doses available, appointments available for doses the same day. 4Cs, Barnstable County Health will still be doing the 4Cs. We're no longer going to be doing the Fairgrounds. Not enough volume to justify having the Fairgrounds open for vaccines. The Fairgrounds need to become the Fairgrounds once again. So there still will be some clinics at 4Cs, especially second dose if that's where you got your first dose. So right now it'll be mainly in your pharmacies. We just did one this week at the schools, and the second dose will be 21 days later. So we did over 200 students between Morse Pond, Lawrence, in the high school for those over the age of 12. And things we'll do pop-ups and things as we can see maybe we get a targeted audience that may not may have a lower vaccine rate. If you're homebound, those that can't make it to the clinic, you can still call the Senior Center at 508-540-0196. We just did, I want to say, around 15 to 18 people this past week using the VNA this time. So that is still available if you've come down to your summer home or your vacation home and you've noticed that there's a neighbor or somebody in your neighborhood and that doesn't get out very often, is elderly, and come to find out they weren't vaccinated and they don't know what to do. Again, if you're watching this and they're not, again, call the Senior Center. We're going to come back out and do those as we get more and more, as people come out of the woodwork and we find more people, we're going to continue to do that. So plenty of vaccine availability. So where are we with vaccines? So at least one dose in Barnstable County, we're up 2% to 71 in the county. And of eligible people, so 12 and over, we're at 78% of at least first dose. Fully vaccinated, we're 4% gain, which makes sense, because of the eligibility being either 21, 28 days later for the second dose, that lags behind. We're at 61% fully vaccinated. In terms of Falmouth, we're at 72% of the entire population and 79% of eligible residents if it's received one dose, with 61% of the entire population, or 68% of those that are eligible, are fully vaccinated. You can see our biggest gains being in the 12 to 15. We did run the clinic. I think maybe some of these numbers might include those clinics because they cut that number off. And we did our clinics Tuesday and Thursday this week. So I know our Thursday ones weren't in this, but perhaps our Tuesday may have been. We were a 24% increase among 12 to 15-year-olds. 24% is really robust. We had 11% gain in second doses for the 16 to 19-year-olds. We're at 61%. So that's the age group. You see 7% gains in second doses between 20 and 50. You see that on the right-hand column. You see 7% increases because their eligibility came later. Now they're on their second dose appointments. So that's where you see most of our gains. We're pretty much seeing all we're going to see with the 75. I have a little concern that we only have 87% and only a 1% gain in second doses when the 75-year-old, but we've been above 95 now for many weeks. So I don't know if we're having, some people may be having trouble over 75 getting their second dose or didn't make it to their appointment. If you know somebody that has that problem, call the health department. We'll be able to fix that. So, you know, we're making gains. We made a 2% gain in total population vaccination, single dose, over the past week. So we are definitely much higher than most of the state, definitely higher than most of the country. And we're in line with what the rest of the county is, plus or minus a couple percent here and there in different towns. And so the vaccine's easy to get, and we're pretty much hitting pretty close to saturation. There'll be smaller gains as time progresses. In terms of cases, we're at 1569 is our case count. That's 3 cases this week. So that's our lowest since October, early October. So we had 3 confirmed cases, 2 probable cases, so definitely a big drop in cases. Pushing almost 99% of the cases no longer in isolation. We're about 11.3% of all cases in the county. And of course, we still do the contact tracing. The contact tracing is not going to go away. That stays with the health department and the VNA for as long as the disease remains. The contact tracing will occur. So that's a great sign. So it's only 3 cases for the week. You can see our case trends is about 8 weeks or so have been dropping, with a nice drop off this past week. The virus doesn't have a lot of places to go because we're around 80% at least with 1 dose. Plus the cases that we did have, you add that up, there's not a lot of places to go for the virus, and you can see that there's been a big drop off in cases, and that's great to see. Again, this is about flattening the curve chart. You can see where we did it in the summer, then we didn't have a very good January, let's say mid-December to roughly April, we had the biggest, steepest incline, but you can definitely see at the end, the far right, that's going back to becoming flat, and that's a good sign. We remain green. Our percent positivity went up a little bit, and the reason being is that the number of tests, it's basically, we were averaging, in a 2-week span, 25, 28, then we dropped into 2s, and now we're about 13, so we're about 600-700 tests per week. So, we had, this is little old data, this is the 2 full weeks prior to this week, so we did have 15 and 16 roughly cases around that time frame, so it was 32 cases divided into 1,341, so our percent positivity went up a little bit, but our cases are dropping. It doesn't count for this past week of 3 cases. So if you go 3 weeks this week, 3 weeks next week, you're going to see that drop way down below 1, and then we would go gray. We need to be less than 10 cases to be gray. So give it a couple more weeks of this trend. If it remains, then we would get into, well below 2, below 1, and then start to drop down as long as, the case counts stay in that 3 or so cases. Barnstable County is still higher than the state, 2.29. It's still a bit higher from the original early April or so spike that we had. The state positivity is at 1%. So the only town, looks like that's Vineyard Haven, is the only place that remained red. All of the towns are yellow or green or gray. Case counts, you can see this is Barnstable County's case counts, so it's the same chart. I give you for Falmouth. You can see the rapid drop off in cases. So the entire county for a 3-day period only had 19 cases, from 520 to 522, 37. So from the 22nd to the 25th, like 19. So you can see that dropping off nicely. Hospitalizations, 3 and 1. So sometimes these hospitalizations from week to week might be the same people. It does if you are hospitalized, you are vaccinated, and you're hospitalized. Especially if you're in the ICU, it takes many weeks. You see that we're still in that 2 or 3, right around that 5 or so cases. But again, if we stay with 3, 3, 3, 3, that'll drop off to 1, 0. But right now, that's what we're at. Statewide, we're in the hundreds of cases now. A couple weeks ago, we were in that 700, 800, 1,000. Now we're in the 200, 300, 400 range. Percent positivity for this particular 7 days was even below 1. I think we're a couple of weeks away from that, a week maybe or 2 weeks away from getting to that lower number because, again, our chart's based on the 14 days of the previous 2 full weeks. So we're, all the indicators from the state, much like with the county, is all on a downward trend. We're reaping the benefits of being well vaccinated as a state, And so all our trends are on a downward way. As far as COVID testing, one change on that, we're no longer testing at the Fairgrounds. That today was the last day for that. Not a lot of people coming to it. The Fairgrounds, like I said before, need to become the Fairgrounds again. And so it doesn't make sense to be staffing testing when we're not really getting any people that want to come. You can still do through Cape Cod Healthcare at the hospital, drive-through, calling if your physician calls the dedicated call center. If you're not doing it that way, the Community Health Center still does it. CVS's do it. I think it's both CVS's, actually. I never fixed that. And walk-in clinics like Convenient MD, it's pretty easy to get a test. You should still be tested if you have symptoms. Good to be tested even if you have. There is occasionally vaccine breakthrough, so even if you've been vaccinated but you have COVID-like symptoms, you should get tested. So that's it for testing. Recap. So virtually all guidance expires for the most part on May 29th, with a couple exceptions. Falmouth is still advising masks indoors in public spaces. Vaccine eligibility is everybody over 12. That hasn't changed. Falmouth resident vaccine rates are similar to other Cape towns. We're definitely well above average. There's plenty of vaccine available. Take advantage. Go to Mass Vax Finder or CVS, Walgreens, Shaw's. There's plenty of vaccine available, and it can be done roughly, usually I see pretty much the same day. State metrics are declining cases, declining in serious illness, so is in Falmouth. And this, again, with 3 cases for the week, it's our lowest case count since mid-October. So that's it for my update for the week, and I'll see everybody next week, and have a nice Memorial Day. Thanks.